All right, so I get questions about the different types of healthcare documents fairly regularly, and a lot of it's just naming differences. So some people call healthcare documents healthcare directives. That's what I typically call them. Some people call them healthcare powers of attorney. I usually don't call them that because there's a durable power of attorney, which is about finances. And so I like to distinguish them by calling them healthcare directives. Sometimes they refer to them colloquially as living wills when you go to the hospital. And living will is a little bit confusing because a living will is not really about living and it's not a will. So that's why I stick with healthcare directive. But those are all the different types of names that you might hear about a regular healthcare directive. There is also a HIPAA waiver, and a HIPAA waiver is a completely separate document. So the healthcare directive is what puts people in charge of making medical decisions, while a HIPAA waiver clears some medical red tape. It allows people to talk to the doctors. So there are laws in place that protect your medical information from being disclosed by medical professionals. And those are the HIPAA laws. And so when you create a HIPAA waiver, it exempts certain people from those laws so that those medical professionals can disclose that information to them. So typically, I create two different documents for people who need medical documents, healthcare documents, and that's a healthcare directive and a HIPAA waiver. So that shouldn't help you decide what kind of medical documents you need for your own estate plan. Thanks.